We are coming to you live on SNNLive. We're at the AdvaMed 2011. That's the MedTech conference in Washington, D.C. I have Neil Campbell from SuperNova Diagnostics, a private company. Neil, welcome to SNNLive.
Thank you very much, Shelley. Pleasure to be here.
It's good to have you. Okay, I love the name. So tell me what the company does.
SuperNova represents the explosion of a star. So with diagnostics, a lot of the inabilities to test measurement, DNA, antibodies, are the lack of the signal to be bright enough to be seen. So for 15 years, everyone's been trying to make very fancy technologies to do this. What we're able to do is actually create the light and keep it up. So we generate a large amount of light, and it stays up for a matter of months. So we take readings over a few minutes, and we're able to measure directly various analytes, such as antibodies, antigens, bacteria, virus, and DNA without amplification. So the goal is to take diagnostic testing to the point of interest, so out into the field, with tests that have not been able to be decentralized for the past 15 years.
So would you say that you're light years ahead of your competition?
Oh, that's a good pun on words. I haven't thought about. We have some good. No, I would say any test, anywhere, anytime, or enabling to put the laboratory in the palm of someone's hand.
Well, obviously, what you're finding out here at AdvaMed is that there are new trends. So how does your new product fit into the new trends ahead?
The problem, so let's take point of care, which is human health. A lot of testing wants to be decentralized, but because of labor shortages and inability to move technology, people are finding very inefficient and costly workarounds. So if you can move more tests in the human aspect of it, there'll be more testing taken up, which will directly affect the bottom line of healthcare economics, as well as the quality of care for an aging population in developed as well as developing countries. Now let's take the other side, non-human health. If you remember the food outbreak we had this summer in Europe,
yes.
People were dying of E. coli.
It was News 1.
Right. It took them 2 weeks to figure out where the contamination occurred, and another 3 weeks to figure out which strain it was, and they found there were two strains that had come together and mutated to form the virulent one, which was killing everybody. So this would allow us to, as soon as something broke, you could go out to the field, you could look at the farm, you could look at the truck, you could look at the food processing, where they put the produce in a bag, and it would allow you to quickly see where the problems are and only isolate those areas that you need to isolate. If you can do that, then you wouldn't shut down the whole system, because it has an economic benefit as well as a medical benefit.
And you don't have false readings either.
That's correct.
So you're not closing down industries where it didn't occur.
You're not closing it down if there's not a problem. If there is a problem, you're only closing down those hot spots, if you will, which are real important. That's why most diagnostics, people are trying very hard to move a lot of these tests decentralized. The problem gets back to the technology limitations. They're miniaturizing these very expensive, laborious processes from the central lab, and they just don't work.
So how far along are you fellas?
We are early commercial stage. So in the non-human health area, we're quickly moving towards food and industrial animal safety, because you breed animals as well as ingest them. So we're interested in that, and eventually affects human health. We're also interested in infectious disease. So the next time there's a SARS or influenza outbreak, we can get our test very quickly to the site of interest and really figure out what problems are occurring versus all this guesswork that occurs today.
So a large customer would be governments.
So customers could be large corporations that process food, governments, hospitals, corporations, pretty much anybody. If you get a result, I can give you some information and you can make a decision with it. That's my customer.
Yeah, and I could see them having these diagnostic kits on hand, just in,
right,
ongoing testing. You don't have to only use it when there's an emergency.
The tests take a matter of minutes. They're room temperature and they have long shelf life, so they meet all the requirements. The other thing we're able to do is get into developing countries. So if I'm in a mud hut in the middle of India, no one's going to travel a dirt road for 2 hours to have their blood drawn. So the local visiting doctors can actually input a lot of the work that is done in the central lab, so healthcare goes up. Good example, we're very well positioned. We have 3 offices in the world: Hong Kong for Asia, London for Europe, and then in Maryland for the United States. So we're going into Asia, and where we got a partnership with one of the largest diagnostic companies in China, And the idea is there's 400 million and growing very quickly middle class that are paying for healthcare for the
just in one province.
Just in one province. Yeah. And it's more than the United States population, and for the first time they'll actually be able to take control of their health.
What's your background?
My background is I've been commercializing science and technology now for about 24 years. I've worked in diagnostics, pharmaceuticals, devices, and then high-performance computing, or the old artificial intelligence area.
I got to tell you, you know your stuff, guy.
So thank you very much. So I'm a geek, but more of a business geek, I guess.
Now, I'm going to give you a tough one. I'm going to throw you a curveball. What's your website?
www.SuperNovaDiagnostics.com.
Thank you so much.
Thank you, Shelley.
Did a
Appreciate
great
it very
job.
much.
I
Thank
learned
you.
a lot about your company.
Thank
Thank
you.
you.